Today's lecture is on phosphorus. It's the second most abundant mineral in the body. It's found in most food sources, so meat, poultry, fish, eggs, milk, cola, yay. I actually have a positive reason for drinking my diet Pepsi. I have a sister-in-law who's a dental hygienist, and she's constantly telling me to use a straw in my soda so as not to destroy the enamel on my teeth. Phosphate-containing food additives add to our phosphorus intake, and it is found in some foods as phytic acid, which is less available, some plant seeds and sources. In terms of digestion and absorption, it has to be hydrolyzed to inorganic phosphate. There's two processes when we think about absorption. There's a carrier-mediated active transport, and then there's a diffusion absorption process. So two separate processes when it comes to absorption. It is stimulated, phosphorus absorption is stimulated by calcitriol, and phytic acid, high levels of magnesium, aluminum, and calcium inhibit phosphorus absorption or compete with. Transport, it's quickly absorbed from the small intestine, and we find several inorganic forms in the blood. Typical plasma range of phosphate concentration I've listed for you. And it is thought that passive uptake occurs in the cells, and the mechanism is yet to be understood. Regulation, homeostasis, PTH, and fibroblast growth factor 23 influence phosphorus, and calcitriol and calcitonin also contribute. Mechanisms of action, there are a number. It's a second messenger or signaler involved in signaling compounds, phosphoproteins, phosphorylated forms of vitamins, phospholipids. It's found in the cell membrane. It does play a role in acid-base balance and also with oxygen availability. It's excreted in both the urine and the feces. High dietary intake will lead to high serum, I'm very, very tired. I have a 8-month-old, so sometimes I'm up quite a bit at night. So high dietary intake will lead to high serum levels, and that will in turn lead to urinary excretion. The RDA I've listed for you, we really don't see a deficiency in phosphorus. I've never seen one. Perhaps if you work in the NICU, you might see a phosphorus deficiency in a preemie, or as I mentioned before, in terms or in relation to low levels of magnesium, refeeding syndrome. So again, people who have been starved for a prolonged period of time, when they are rapidly refed, the serum magnesium, potassium, and phosphorus levels will plummet, and that has cardiac implications, which actually can lead to death due to cardiac arrhythmia. Toxicity. This is interesting. One of the few that has toxicity levels based on age range. So the toxicity level, if you are 70 or older, decreases from 4 grams to 3 grams. Assessment of nutriture, serum concentration and urinary excretions are the primary means. They're not that specific or sensitive, so in other words, they're not that great of an indicator. Just like calcium and magnesium, the serum concentrations can be maintained at the expense of tissues. So although the serum concentrations might be normal, the actual tissue levels of the mineral might be deficient. And that concludes my phosphorus lecture. Thank you.